Greetings, my name is Kimberly Early and I am president of the BCDI-Seattle Village. Welcome, welcome, welcome. As we start off, the first thing I want to start off with is doing a libation. A libation is for people who have passed away. They could be ancestors, they can be associates, friends. Some names we may know and some names we don't know. With this one that I'm going to do, the libation, these are for people who have passed away who are part of BCDI Seattle. We are here because they were here. These are people whose backs we stand on, who have built the foundation, and who opened the way for us. First, I'm going to start, and what I have is some water in the plant. I know you can't see it, but it's over here. And I'm just putting some water to the plant as I say their names. The first one is Bunny Wilburn, who was the founder of BCDI Seattle. Do a libation to Edith Zhao. She was our historian. She was also in education. Dr. Zakiya Stewart. She was also in education as well. Elizabeth Thomas. She was a health education person, and she did Black parenting classes. Gary Owens, who was in public policy, and James Staples, he was in juvenile justice. So I just want to stop and give thanks to those who have come before us by doing libation. Moving my plant over. Next, I want to make sure I take this time to do a land acknowledgement to recognize Indigenous peoples on whose land we stand and that we reside on in the Seattle area. They are known as the Coast Salish people, and they include the Duwamish, they include the Suquamish, the Stillaguamish, and the Muckleshoot people. We want to make sure we honor the Indigenous people who have been living and working on the land from time immemorial. We at BCDI Seattle are excited and overjoyed to be here to celebrate National Black Child Development Week with you. This year, 2023, is BCDI Seattle. We're celebrating our Golden Jubilee. That is 50 years in existence. Woo! That's so exciting. And here is to 50 more in existence. This year, we also plan to do some activities, some celebrations, so we hope you can join us when we do. One of the things is that when we found out about Black Child Development Week and that we had the theme of honoring a pillar in the Black community, we were overexcited, and we thought that no one would be more deserving from our BCI community than one of our long-standing members, Miss Sadikifu-Akina James. She is the epitome of what it is like to work within the public sector while at the same time making changes to public policy that directly impacts Black children and families. And when it gets better for Black children, it gets better for all children. Sadikifu-Akina James, her work of mentoring others, her love of Black children, her love of the community, her dedication to fighting against institutionalized racism, her volunteer work in the community made her a perfect candidate and an honoree as a pillar of the Black community for BCI Seattle Village. I want to say an extra special thanks to Deborah Sullivan, Dr. Deborah Sullivan, who when we were talking about this, she was like, let us honor Sadikifu. And I was like, that's it. I'm excited because we're like, what are we going to do? I also want to give thanks to Bill Butler for doing the videotaping, and thanks to Anthony Tackett for putting the final product together. Now, I want you to sit back, I want you to relax and enjoy this interview with BCDI Seattle Village's pillar of the Black community, Miss Sadikifu-Akina James, as she discusses the history, her history, BCDI's history with us. Sit back and enjoy. Thank you for joining us. We are here with Sadikifu-Akina James, and we want to interview you for the Week of the Black Child because not only because of the week, but it is our 50th year anniversary of BCDI Seattle. So you are one of our longtime members, and we figured what better way than to get it from you. one of our first questions is, can you tell me how you first got involved with BCDI Seattle?
Yes, that's something that I actually remember. And I believe my first involvement with BCDI was attending a CDA training that Dr. Wanda Hackett was putting on at St. Edward's across the lake. And it was a weekend training, so we stayed overnight there. And at the time, I worked for Head Start, not in child care. I was the parent involvement and social services coordinator for the grantee, for the Head Start grantee in King County. But I got a lot of ECE training. So that was my first involvement, was going to that training.
So now after the training, what made you stay involved with BCDI?
I'm not sure. I think I actually went to more training. I went to a national conference, and I don't actually remember my first involvement of doing projects myself. I actually don't remember what that was. I do not remember. Because what I remember the most was something that happened when I was president. So I'm sure I did some things before with BCDI to become president, but I don't remember what they were.
That's okay. And then, so you said you were president, and what other offices did you hold within BCDI?
I think I was secretary, and then, I child welfare chair for 20-something years. Mm-hmm. I worked on ECE and education, but I didn't chair any of that. And then I did some work on juvenile justice, but I wasn't juvenile justice chair. So basically just secretary, president, and of course now I'm public policy chair, so public policy.
When you were president under your term, what are some of the memorable things that you did, or things that stood out for you as president?
Well, I would tell you something that stood out for me. It may not be what you're looking for, but it's something that I remember. It taught me a lesson. Because at the time, BCDI was not incorporated. And so we decided to have the Ron McNair camp-in at the Seattle Center. So I signed a contract on behalf of BCDI for 500 kids to participate in the Ron McNair camp-in, overnight at the Pacific Science Center. The total was over $17,000. Well, we partnered with an organization that had been created called Blacks in Science. That was headed by Millie Russell and Vivian Caver, were the people who work with us. And Millie was at the University of Washington. Vivian had done, I want to say it wasn't public policy, but she had chaired one of the departments at the city of Seattle. As we started to plan the event, and as it got closer, we actually, Dr. Zakiya Stewart was the person who was planning the event with the Pacific Science Center in terms of what would be the activities that would go on for the 500 Black children that we expected to attend. I took care of the sign-up since at the time I worked at the East Cherry YWCA. It was easy for people to come to the Y and sign up and find out more about what was going on, what was going to happen, what they would need. And so I took on the responsibility of making sure when people signed up that they were going to be able to have like a sleeping bag, or we get them a sleeping bag, or sometimes we had church groups who signed up as a group, and just making sure that people were going to have everything they needed. Well, Vivian and Millie decided they wanted to have kids to be able to sign up on the same day as the event at the last minute. I cut that. I was no. Well, part of their job, the thing about it, BCDI was to plan the event and do all the stuff for the event. Blacks in Science was to money raise, to raise the money. And so at that point, because I wasn't willing to sign up kids or families or anybody else at the last minute, because there are lots of things that we needed to do and needed to have, it just wasn't going to work, wasn't going to do it. They said, well, they weren't going to provide the money that they had raised. And I had signed this contract, and of course, BCDI wasn't responsible. BCDI wasn't incorporated. And it was $17,000. I only made $18,000 a year. And so by the time we went there for the event, we were actually supposed to pay the Pacific Science Center the money, because of course I didn't have one penny. But fortunately or unfortunately, they were so afraid of having 500 black kids at the Pacific Science Center, they forgot to ask me for the money. They were just trying to make sure that everything was okay. They had hired so many college kids to surround the Pacific Science Center to make sure no kid escaped or did anything, that they never asked for the money. So after it was over, and of course it was a very successful event. There was actually 499 black kids and one little white girl. Millie and Vivian changed their minds, and they did provide the money. But that taught me a lesson about organization. That's what I remember the most, the very most. Because I was thinking, I don't know how I can pay this money back.
And did you have any more campings after that as well, or?
Actually, Blacks in Science had more campings. BCDI did not do any. BCDI was responsible for the very first camp-in. The idea of the camp-in was, here again, Dr. Zakia Stewart idea that we have the camp-in. And so she worked with the Pacific Science Center and with Blacks in Science. Blacks in Science, we would meet with them. They would actually bring in these engineers and black scientists from NASA to meet with us. So it was very, very interesting and whatever. But on the real side, it was very scary for me, thinking that we would not have the money that we needed. But no, BCDI decided it had done all it needed to do for camp-ins. And so after that, there were camp-ins, but they were conducted by Blacks in Science.
But that was exciting that they started that kickoff for the first camp-in, though.
Yes,
so.
Yes, it was very exciting. The parents loved it. The kids enjoyed it. They really did. We had groups of kids. Like I had for some reason I ended up with a group of boys, which happened to be my friend's kids. My best friend Fulian, her son, my friend Roy Lally-Barn, her son. It was friends of mine's sons, and they were too much. But it was still all good. It was all good.
That is great. So what are some areas that BCDI-Seattle has shaped and or impacted policy in the Seattle area?
I think there are many. I think we've shaped policy in every area that we've worked in. Early childhood and the survey that BCDI did. As a result of that survey, and one of the problems with trying to gauge what the impact is of the things that BCDI has done is that we don't ever really have, whenever the event or the whatever is over, we stopped with the data collection, whereas the impact goes on. So we technically are never aware. It would be wonderful if we have, in some of these things we did, had some professor from the UW who actually studied what we were doing and studied more long-term the impact of some of the things that we have done. But we haven't had the ability to do that, but let me go back and give some examples. Just with the survey, when the results came out, Norm Rice committed money for training for Black child care providers. As a result of that commitment, Black child care providers, for the first time, needed training. The problem was, because at the time, before that, I think I went to work for King County as coordinator of their child care subsidy program in 1989. Before that, I worked at the East Cherry Y, and we had a child care program. And it just so happened we were in the, census tract that had the largest number of the poorest people in King County, who also all happened to be Black. Had the poorest people, and they were all Black. Most of them, and who were working, brought their children to our child care facility. Kazi was about 4 or 5 blocks from us. So they but they weren't in the same tract. But they got a similar kind of population of parents who used them. And both of us experienced, from my point of view, similar things from the city of Seattle, which was to never receive what you needed for the population that you served. Let me just leave it there. So when I went to work for King County, and the African American Child Care Task Force was formed, at the second meeting, I took them a proposal that asked that they do a survey of Black providers so that we could use that to take it to the politicians to show the needs of Black providers, and ask that they do that survey with Black Child Development Institute. Because I never think that any person who represents Black people who works for a government organization thinks they can do something on their own. They cannot. They need a community connection. So I didn't think it was just okay for the African American Child Care Task Force just to do something by themselves. They needed a community connection, and the best community connection I knew was BCDI. And so then they accepted that proposal, and we did the survey. Norm Rice responded, but that's kind of where things stopped. We know that the city of Seattle changed how it did its training based on the report that we provided from that survey. But what was even more important was the fact that after that, Black child care providers got even more access to training. That's the part where we don't have any statistics. We don't have any follow-up because we never do anything. We don't have the ability to do the kind of follow-up that's needed to prove what our impact is. We can prove a certain kind of impact. Like with the survey, we can prove that Norm Rice said, here's X amount of dollars, and that's specifically for Black child care providers. But that's about the only thing we can prove. But what it did was to start the trend for Black child care providers having more access to training. Because it did not happen before. I don't even want to tell my own story. It's too, because I tend to cry when I tell that, so I will stop there. That's for early childhood. Let me go to child welfare.
Just wanted to clarify, and we'll go to child welfare. So Norm Rice was the mayor at that time.
Yes.
People didn't know. And so when you said they were able to have more access to training, what does that mean? Does that mean like I can go and ask for the trainings I want, or there were more trainings offered to the community?
I'm not clear. What I know is that the city of Seattle changed how it did its training. I believe people had more access in the say of what they wanted or needed for training. When I was a provider, your child care program representative came out and told you the training you would have.
Oh, okay.
They told you the training you would have, when you would have it, and you set aside the time.
No choice in this. Okay.
There was no choice. There was no choice. And one of the things that, actually that happened for everybody, you got more choice. Child welfare was the same. It started with a survey, and everything doesn't have to start with a survey, but it's just an example here again of another policy field, because we work with national as 5 different areas to do more or less a survey of the records of every child, every Black child in the public child welfare system for a particular year. And we participated in that. That was kind of a big deal as of itself, because that meant DSHS gave us access to records. And we probably got every Black social worker in King County to volunteer to read records. And we got some other people who were trained, like I read records, Siobhan read records. But for instance, James Kelly at that time, he headed one of the units. And so he would come in on Saturday, because we had volunteers reading the records. They always had to have someone who would work for the system to be there to oversee it. And so James would come in on weekends, and we, the volunteers, would go in and read the records of children. And so all of that came out in a report that was about who will care when parents can't. And we actually what I did was to actually put together just Seattle's part, and we still have that, of the results of the reading of those records. And a lot of that was the crack epidemic and what was happening to our children and all that. But as a result of that, we actually formed a child welfare committee, and I won't go through everything that we went through. We went through many iterations. We ended up, sometimes we did free training for DSHS. We did free training for other child welfare providers. And then we ended up with almost 50 people. I think it was 50 people. We ended up with 50 people who were involved with us. When we finally decided we needed to look at what happens before we get to the system, how can we keep them out of the system? And so that's when we started to look at what could be done ahead of time. And because of our work, and here we're all volunteers just working together, but most of the people who were volunteering actually worked for DSHS. They were social workers for DSHS. But we had people from everywhere. We just had community volunteers. We had retired social workers. We had professor from UW School of Social Work. We had many different kinds of people who were involved, but we all worked together. I cannot repeat how important it was, is that we spoke with one voice. We all worked together. We worked out what we wanted, what we needed, what we thought ought to happen, and we all agreed on it. As a result of that, the University of Washington School of Social Work was working with a social service organization to put in a grant to see if they could make some changes in DSHS that would be good for the kids. And at first they asked us, let's see, I think they wanted to pay us $35,000 if we would do, per workshop, if we would do 2 workshops for them when they were doing this grant. I politely refused that because the one thing I knew is that so far as Black kids in foster care, we had in our group the top talent. We also had in this group, here again, this is how the system works, but there was an organization that got most of the contracts to provide services to families. And so they had two Black people who worked for them, 2 Black social workers. But them 2 Black social workers ended up working with our group. Now, they didn't necessarily come to our meetings all the time. They worked with us on the down low, because one of them, she was really good. She had actually, because you had to be certified in a certain kind of thing. One of the things that happens, I'm going to go to something that I talk about all the time, is that every time we as Black folks learn something, they say, this is the system we're going to use. This is the kind of training, or this is the strategy. So Black folk go off to learn it. By the time we learn it, they say, nope. Yep, they change it. They always change it up. So at the time, they had come up with this new strategy. Of course, most Black people didn't have certification in that strategy, but these 2 Black people did that worked for them. One a Black man, one a Black woman, and the one Black woman had gone to Harvard for hers. But both of them were real good with us on the down low. They let us know all the time what was happening with that organization. In none of the other things I worked in have I ever worked in anything so close where we had so many people, even though we were all different and everything. We could see, it's like we saw through the same eye. and we spoke with one voice. And so we refused to participate in this thing because they wanted to apply to Kellogg for this grant, UW and this other organization. But of course, there was something, I believe, in the grant that said they had to have like black community or folks involved or somebody who had knowledge or whatever. And so they thought if they could get us to do this workshop, well, wasn't about to give away our stuff. Even though none of us was getting paid to do this, they were all volunteers for what we would do on Saturdays. We developed a model, we developed a lot of stuff. But it wasn't for free for them. And so ultimately we worked out where we would be one of the participants in the project. And so we ended up with a grant. Oh, I don't remember how much I don't know, I think it was a 2.5 year, I don't know, I think we got $200,000 a year for our participation. And our participation was just to review what they were doing in the system and make recommendations on what should happen. Anyway, we do have information about the project and what we did and what happened as a result of that project, but going back to how we impacted policy.
And so what happened, what it sounds like is that that one organization basically just wanted to use you all.
Yes.
So they could get the money.
Yeah.
And act like this is how we work in community with the black community.
Yeah. Did not happen. BCDI saw to it that it did not happen because, and what they did, they would go to, like, we had people who worked in the system and we had people who were private contractors who worked with us. I mean, we had different kinds of people in the system, but we were all together for black children. And so they would go say, so and so and so, will you come to, and they would tell this person that, you know, you really need to talk to Sadikifu from BCDI. And then they would go to somebody else, they would get the same message. And so finally they had to negotiate with us. And so we negotiated being a part of this project, being a partner in the project. We were a partner.
That says a lot when people are really sticking together.
And people were sticking together. Yeah. I haven't been in any of the other policy things I've done, but these 50 people, irregardless of whether you were a community volunteer, you were a professor at UW, you were this Harvard person, or the whatever, we all stuck together. But here again, it took a while. It didn't happen overnight. It took a while in terms of our meeting and going over things, but people took the time and we stuck together. And so as a result of when the project was over, we had recommendations that we took to the regional director at DSHS about what they are to do for black families in terms of the kinds of services. Now, this is where, when Zenobia and what's her name, when they start talking about it, and then we had these people talk, that's where they came in. Joe, who was the regional director, he called, I think, 3 or 4 of the people who were in our group, plus Zenobia and whatever, and then they worked out what they would actually do on the ground, and they started the first project in terms, Oasis, of serving African American children and families, but it was based on all the work that we had done beforehand just to get to that point. And yeah, it was actually what, here again, BCDI, because people saw it as BCDI, and working with these 50 people, we were able to say, here are the principles, here are the strategies we believe need to be used from everything that we've seen in terms of working in the system. I'm shortcutting a lot of stuff, because here again, this was a 2.5-year project. But that's what we did, and we took it to Joe. And then that's when Joe called all these other people together, so they set up an actual project to work with children and families, OASIS, Office of African American Children and Services.
And Joe was the director over at Department of DSHS.
Yeah.
Geraldine and Zenobia are current BCDI members.
Yes,
So,
yes.
okay, so you talked about child welfare, and then what?
Oh, juvenile justice.
Juvenile justice. Okay.
Yes, here again, I go back to a survey.
That's okay.
But a lot of times a survey can start you out. Not everything's a survey, because, anyway, juvenile justice, James Kelly, who I said oversaw an office or a section around child abuse in this region. When he left there, he went to be the director of African American Affairs Office.
Oh, okay.
Yeah, James went to be. And one of the things he did was a study of black kids in the juvenile justice system. And so he sent that around to people. And as a matter of fact, and then it came to King County. I was actually still working in child care. I must have been about 3 or 4 years, because I went to work in child care in 1989, but I became division director in 1994. So it would have been before 1994, probably 1993 or something like that. Oh Lord, these years and numbers don't work for me no more. That James came out, but he certainly made sure that this study got out and challenged, these cities and counties to do something about it. And so at the time we had a Republican executive, Tim Hill, and so he had asked all his departments to come up with a recommendation about how do we respond to this information that James has provided. And so when my boss in the Department of Community and Human Services asked, because I was in child care though, but she asked everybody, she just asked that to me. Well, I came up with an idea. And of course, that idea involved the BCDI and a survey. But this one was a survey of black folk and getting their ideas of how do we work with our young people to keep them out of the juvenile justice system. Yeah, and my suggestion with that was that, BCDI be asked to do this, and that we survey the young people too, who are in the system. And so when my boss took it to the exec's office with all the other departments, they actually voted on what they wanted, and they selected our department, what I had given to my boss. And so Tim Hill, I call his name because, number one, he supported what I did in child care. even though I did something that was radical at the time. He supported it. You wouldn't believe a Republican would, but he did. And he supported this in taking it to council. And council agreed, although we had to go to a different group to get money for it. And so BCDI did the survey, produced the report that came back, and then using the report from BCDI, we designed the project. The report was called Reaching Back, Giving Back, and I don't know, the project has been called a lot of different names over the years because it lasted almost 20 years from the time it started in terms of black kids in a juvenile justice system. But I think that project ended in 2017. This would have been started way back when, let's see, maybe 2005 to 2017. And I know that they had 4 reviews, outside reviews of the project, and they always got good stuff. It worked. But BCDI doesn't get that credit because BCDI's stuff stopped off at, we produced the report and here's the report. And the report, I don't know, there was 100 and something black folk from all around the county because we interviewed people from all over the county. And Yvonne was responsible for interviewing kids that were in the juvenile, as I would call it, the juvenile jail. And so she and a group of other people interviewed kids in the juvenile jail. As a result of that, this project that got so many of our children out of the system or made sure they never got into the system happened. But it's kind of like we always stop where the last thing that BCDI does, but what BCDI has done has had a lasting influence. That project would not exist if it weren't for the work of BCDI. It's just like all the other stuff. Everything I've been talking about would not exist if it were not for the work of BCDI. But that's hard to prove. You can't prove it because I'm just talking because I know it. But we don't have any independent thing to say that.
Right. And so what about just one more field in education? I know you did child care. What about in education as far as policy?
Well, I actually think that BCDI's biggest impact has been in education. And here again, I didn't have anything to do with it.
But you know the story.
Yeah, but I think I do know the story. Here again, Dr. Zakiya Stewart. From my point of view, when Zakiya was able to work with the district, and I don't know if she was working with other people or whatever, to get them to produce statistics. Originally, Seattle Public Schools said they couldn't do no statistics that would show the number of African American kids and the number of African American kids who were getting disciplined and all of that stuff, that they couldn't produce that. Just being able to produce those statistics has had such an impact in terms of all the other things that we have done or have been able to do. Just think about yesterday when Bill and Beatrice were talking about the project that they were doing. How do you know? How can you identify the black kids and the whatever? You know, it seems like nothing now, but it wasn't nothing then. it had to happen. One of my things is that nothing just happens.
Right.
Somebody makes it happen. Yeah. And I just think that was absolutely one of the most important things, that it has just created all of this other stuff that would never have been there if we weren't able to see who our children were and how they were being treated. So that's one of the things. I think the other thing I think is, here again, Dr. Zakiya Stewart, is what was the name of the project where we accompanied parents when they were going to
Right, if your child got suspended.
Yes, yes.
You would have a parent go with, you would have somebody from BCDI who had been trained go with you to the meeting to advocate for you.
Yes.
I'm blanking on the name, but I know what you're talking about.
Yes.
And there was a hotline.
Yes,
Yes.
yes. Here again, I think that was a very important project, because it was, BCDI does two kinds of things. We do direct service projects, which that's a direct service project, and then we do other things that are more policy, so to speak. This was a wonderful direct service, like we give out books. We give out books now. That's a direct service project. That's something that people can see and feel and right now. Mm-hmm. Most of the thing, like when I was working on child welfare, I worked on child welfare for 22 years just to get where we got. Lots of good things happened in there, but there was never a lot of things that you could say right now. You can see, feel, and it's okay, and wow, look what we did, and da 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 da. But I just think that particular project was one where BCDI put its foot on the ground in the community, and it helped people who probably had the least access to the system and resources in the system, helped them to get and be represented just like everyone else. I just thought that was wonderful.
And I remember when that hotline happened, I had just gotten trained, and my niece got suspended from school, and the letter said assault with a deadly weapon, and the deadly weapon was a plastic bottle.
Oh.
And they wanted to suspend her, I think, for like a whole week. And there are all these little things, like you have to answer within a certain amount of time, like 3 days, and if you don't, then they're going to suspend you for a week. So I had to go in and advocate for her and her mom.
Yes.
And get that. They changed it, because I was like, this is not a deadly weapon, it's a plastic bottle. Why are you putting that on there? So it was really helpful to get that training ahead of time. Because if you don't know
yes.
these things, you just,
that's right.
I guess you're suspended.
That's right.
Yeah.
Yeah. And so I just thought, in terms of policy, it woke up the system about our ability to do things, because I'm sorry, but the system will, I can't use that word, system will mess you up as much as it can if you don't have somebody who knows. I have to say, fortunately, when I worked in the system, I knew. I can say now, I didn't say it then, but I was very, very, very good at my job. I thank you, Lord.
So, when you think about the past for BCDI and the future, what makes you keep going on and staying with an organization? Because, people come and go, not only in just BCDI-Seattle, but other organizations as well. But what makes you like, I am dedicated and I'm still here?
Well, because I think that BCDI is dedicated to our community and to our children and families. And I like working with people who want to do that and who do that. I like that. And I have to admit, I like doing the work. I like it.
And it is a volunteer organization.
Yes.